So this is tilt table with treatment, and we use this for treating patients that have dysautonomia. So what that means is they have an imbalance within their autonomic nervous system. And so when they move and make changes in gravity, so if I go from sitting to standing, I'm changing my position in gravity. When they do that, they're not getting the proper vestibular signal to sense where they are. That could be the first issue. And then the second issue is their autonomic nervous system does not respond appropriately, right? So if I go from sitting to standing, gravity is going to pull blood down to my feet, right? And so I need to have a response that increases my blood pressure and my heart rate, so I can combat that whole blood pressure or the gravity change that's pulling blood down. I need to get blood up to my brain so I don't get hypoxia. So when patients don't do that appropriately, and it could just be a slight imbalance, they don't feel good. They feel kind of terrible. And so we know that they're not getting appropriate blood supply throughout their body. So we use the tilt table, and we go 15-degree increments, and we take their blood pressure and we say what's happening, okay? Like, is it too low? Is it too high? What's happening with the heart rate? If it's too low, is the heart rate responding appropriately and increasing? Because if not, we got an issue of people fainting, the syncope component. So then, as we put them at these 15 degrees, we can start adding different treatments that are going to change their nervous system integration and allow them to have a more appropriate response. So that's what we're doing here. We're just combining different modalities, activating different cranial nerves with SSEP or some vagus nerve stimulation to either increase parasympathetic tone or increase sympathetic tone, or decrease, vice versa. It's really powerful for making these neuroplastic changes within your autonomic nervous system, so somebody feels so much better moving around in their world because they get appropriate blood supply.